All right, the number two most common type of low back pain that I see is it's kind of a mixture of things. So it's called degenerative disc disease, OsteoArthritis, or stenosis, which just means if you have a hole, that hole gets a little bit smaller. So stenosis is actually caused by osteoarthritis, which is actually could also be caused by degenerative disc disease. Now, what I mean is that over time, as we age, and this problem usually occurs in people that are over 50 years old, and what happens is over time, the height of the disc gets a little bit smaller. So as you age, you've probably heard people say, or even yourself, say that they've lost their height. They're not as tall now as what they used to be when they were younger. And in part, that's attributable to the loss of the height of the disc in your spine. So this is the disc. So again, this is the bone. This is the bone. This is the vertebrae. This is the disc. Spinal column or spinal cord with the nerves, spinal nerves coming out. What happens as we age, we start to lose the height of the disc, and you can see that this area here, where this nerve root is coming out, it kind of forms a circle, okay? And that circle, over time, as we lose height of the disc, that circle gets smaller. Now, in reality, I drew this, and it looks a lot larger. The relationships are a lot smaller here. So there's not a lot of space here to be, there's just not a lot of space there. So there's more chance of this nerve being impinged upon. So what happens is we lose height of the disc, and this nerve gets encroached upon as this gap becomes a lot smaller. So this circle here gets a lot smaller. What happens is it brings the joints of the spine together, which are in the back here. So the joints are in the back here. And what happens is these joints actually experience more force, more trauma, if you will, and that causes arthritis, osteoarthritis at the back. And then that builds up growth of the bone in the circle here, which further makes that circle smaller, and then it eventually impinges upon that nerve. Now, what you'll feel is if you're over 50, is that you'll often feel kind of stiff in the morning. It's worse in the morning. You feel worse when you're standing and you're walking, especially for long periods of time. It often feels better when you sit down. It feels better with a hot shower. And the reason why that is, in the morning, it hurts most because of this arthritis here. Arthritis is most commonly more painful in the morning, gets better as we loosen up with heat, with a hot shower. And when we stand up and we walk around, what happens is we're extending our back. So if I face the way of the drawing, we extend our back when we're standing, we extend our back when we walk, and if we're constantly extending that spinal segment here, we're closing down that hole even more. So we're impinging upon that nerve that comes out of the spinal cord there. And so that can cause problems, that it can cause pain that goes down the leg again. It can cause weakness. Like it can cause you to feel like you're tired, or maybe even like you're going to lose your balance as well. So this is important when you're determining when somebody says they have sciatica. There's a lot of different things that can cause sciatica. Sciatica is just a term called pain that goes down your leg. So these nerves, these spinal nerves come together, they form one nerve called your sciatic nerve, and that comes down your leg here. So if we do activities that extend our back, it makes us feel worse. If we do activities that bend forward, it makes us feel better. Now, here's a little trick. You can actually go into the supermarket, and if you see somebody that might look like they're over 50 years old, maybe have some silver hair, some white hair. They're probably a little bit older than 50, but if you see them leaning on the shopping cart like that, they're flexing their spine and they're probably alleviating this pressure that's being had on their nerves. So again, your pain is worse in the morning, you're more stiff in the morning. It gets better as the day goes on after a hot shower. You're better when you sit down or when you bend over. So that is degenerative disc disease, osteoarthritis, and stenosis.